just want to disclaimer the PharmAssist virtual learning experience brought to you by Mandel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the nurse is the opinion of the nurse and is not intended to replace the recommendation or request of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. So again, welcome everyone to the first online live pharmacy medicational instructional program hosted by Mandel's Clinical Pharmacy. And this is an educational program created by Mandel's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your home. PharmAssist takes place every Monday at 7 p.m. Eastern Standard Time. Tonight, we'll be providing a live medication instructional program on 3 fertility products, which are going to be Minipure, the Gonolife Pen, and Progesterone in oil. Including interactive question and answers throughout the program. So like I said, any questions come up, y'all can just enter in the chat. Please join us via Zoom, usually Facebook, and we invite you to be part of the discussion by sharing those questions. We are joined every week by various amazing healthcare professionals from across the nation to provide you with real-world experience, just as if you were sitting across the table from them in the clinic. Today, we are joined by Laurel Meier. And then again, thank you again for your time and interest this evening. And now I'm going to turn over to Laurel.
All right. Hi, everyone. My name is Laurel Meier, and I'm an IVF case manager here in California. So it's 4 o'clock here, or a little after 4. So tonight, as Morgan said, we're going to be going over Minipure, the Gonolife Pen, and the Progesterone in oil. And please put any questions you have in the chat function, because any question you have, someone else is going to have a benefit from. They're gonna have that same question too. So after this program, this is recorded, and so it will be available for you at mymandelsPharmacy.com, maybe the Facebook page, probably, and then on YouTube as well. So to get started, I'd like to share a quick story on how I became interested in becoming an IVF case manager and why I wanted to share this information and expertise with you through my Mandel's Pharmacy Assist program. About 25 years ago, my husband and I started having trouble getting pregnant. And after going through a couple of rounds of Clomid without success, we did turn to IVF. We went through a couple of rounds of IVF and unfortunately didn't have success there either. So while we were still reeling from the news of the negative IVF cycle, I got a call from a friend. She was a labor and delivery nurse, and she had a patient that had just delivered a baby girl. And she told her patient about my husband and I and how we were wanting to adopt. And the patient wanted to meet us. So the next day we went down to the hospital. We met her, we talked. She decided that she wanted us to be her baby's parents. So we were parents the next day. It just happened to be Valentine's Day. So it was a very, very exciting day. And then 4 years later, we did go through some ups and downs with a failed adoption, a second baby that we were going to adopt that didn't work out. But then 4 years later, we were the recipients of an adopted embryo, which was transferred into my uterus. So through a frozen embryo transfer cycle, and I got pregnant and had another little girl on the 4th of July. So my girls are now 17 and 21, and here they are. You can see them, that's Megan and Sydney. And I share my story because I just wanted to know, I want you to know that you're not alone in this journey. There are thousands of people going through this process. There are friends and family and other people going through IVF that I just really would encourage you to reach out to and to talk to, share your story. And in hearing theirs, it hopefully will bring you strength to continue on in your journey. This is a very difficult process. We know this. I have a feeling I know what you're going through, and that's why I'm doing this. I want to help. So please take this one day at a time. I know you will get through this. Keep the faith. So to get started, I also wanted to mention that my story has a lot more ups and downs than what I just shared with you. Full disclosure, the emotional roller coaster of IVF. I went through all of that. And if you want to hear my complete story with all of the gruesome details, you can go to mymandelsPharmacy.com, go on the Behind the Shots tab, and you can watch it there or on YouTube. Behind the Shots, Laurel story. So that's available if you would like to listen. So tonight, my goal is to help you learn how to give these shots and give yourself the confidence so that you will feel like a pro. So we're going to start with Minipure. And if Morgan, you could start the Minipure video, that would be fantastic. Hi, my name is Laurel, and today I'm going to demonstrate how to mix and give the Minipure. Minipure comes in little powders, and we're going to use our imagination, and we're going to pretend that there's little white discs of powders in these vials. You'll also need a container of saline, a Q-cap, which is a needleless mixing device, a 3 ml syringe, and a small needle for giving. So make sure you have all your supplies ready. And the first thing you're going to do is take the caps off of your supplies. Now, some clinics are going to order for you 1 vial of Minipure. Others will give you 2 or 3. So just follow your clinic's instructions on how many vials of Minipure. Each vial is 75 units of medication. So if you're told to give 150 units, that would be 2 powders. You're always going to be able to mix this Minipure and give it as 1 shot. So the next thing we're going to do is to peel that off. The Q-cap will go directly on the liquid. Just pop it on and take the plastic covering off so it looks like this. Then you're going to take your 3 ml syringe and you're going to put 1 milliliter of air in the syringe, and you're going to twist it onto the Q-cap. Now, keeping it on a hard surface, you're going to push the air in and invert it. Draw up 1 milliliter of the liquid. So you go a little past the 1 and you push the air out until you're right on 1. Pull off your liquid and put it to the side. Now we're going to pretend to mix the powder. So here's the first powder. You push the Q-cap on, you inject the liquid into the powder, and you swirl it very gently. This powder will instantly dissolve. Now, if you have a second powder that you need to dissolve, you're going to push the air in while it's inverted, pull everything back into the syringe, take the empty vial off, put it to the side, and then do the same thing with the second powder. Push it on, inject this into the powder. It will dissolve immediately. Swirl a little, turn it upside down, push, and pull all the liquid back into your syringe. Now, when you're done with all of the powders that you've been told to inject, you're going to twist everything off while you're still pointing your syringe at the ceiling. And you're going to take your small needle and you're going to add the needle. The needle goes on like this. Twist it on, pull the cap straight off. And now it's time to get rid of that air. So just push until you see a drip of liquid at the tip. And you're ready to give your shot. So this is given in the abdomen. Pick a spot, stay an inch away from the belly button. Don't inject into a spot that has a bruise from a previous shot. Anywhere you can pinch some fatty tissue, just give it a pinch. Inject straight in at a 90-degree angle. Let go of the pinch. Inject your medication. Wait 3 seconds. Grab a Kleenex. Pull out and hold with the Kleenex. After about 10 seconds, check your skin site. If it's dry, no bleeding, you're done. If it's bleeding a little medicine's leaking out, just keep holding it until it's dry. Everything goes in the sharps container, and your next shot, you're going to get a whole new supply. That's all there is to it. All right, Morgan, any questions about Minipure for me?
Yes. Okay. So first question was, is it normal to use Minipure in conjunction with other FSH medications, as in Gonolife or something like that? Is that pretty normal in a patient cycle?
So yes, many clinics will combine Minipure with an FSH only medication. So just a little background, Minipure is a combination of FSH or follicle stimulating hormone and LH or luteinizing hormone. And many clinics will combine the two because they believe that the LH is important for a successful IVF cycle as well, or it can help. And there's also FSH only cycles where Minipure is not used, and these are successful as well. So it's just best to ask questions of your provider. If you're not sure what's best for you, I would say either one does work very well, but it's very common indeed to have a combination of FSH only and Minipure.
Okay, great. Someone else asked, so how many vials of Minipure can you use with the 1 ml ratio until you should add more liquid? So is it 2 vials, 3 vials, 4 vials until you should increase the 1 ml of the diluent that you use?
That's a good question. In our clinic, we recommend using 1 milliliter for up to 4 vials of Minipure. It's pretty rare to use more than 4 vials of Minipure, but I would ask your clinic if you do have more than 4, if maybe you should add a little bit more extra fluid.
Perfect. I would say the exact same. Someone else asked, so they felt that the Minipure is burning a little bit more at the injection site than compared to their other medications. Any tips or tricks you can help with that burning sensation / itchiness?
Yes, very good observation. It is the most painful shot, I would say, in all of the IVF cycle medications. The best tip I can give, well, there's a couple of things. You can ice the site before you give it, and that helps. You can use either Emla cream, which is a numbing cream. You can use a Sonera patch, which is a lidocaine tetracaine patch, which has an iron ore in it. So when you open it up and you put it on your injection site, it starts to warm up, and that pushes the lidocaine tetracaine into the skin surface, and that numbs it very well. And if you choose not to do any of these little things beforehand, my one trick I've found works really well is to just give this medication as slowly as you can. So you start giving that and you just start feeling that sting, just slow down, and it'll definitely ease up.
Yes, that's a great tip. Another question is, how should you store Minipure after using it? Or if you get the powder vials and liquid vials, can you store it in the fridge or outside of the fridge? And then lastly, can you mix the medication ahead of time and then keep it stored to give it at a future time? So, sorry, 3 questions. How to store
Okay,
it.
so
Yeah.
okay, I think I got them all. So basically how to store it, best way to store this is in the refrigerator. It's not going to be damaged per se at room temperature, which is considered 68 to 77 degrees. But it is recommended that you put it in the refrigerator for the longest shelf life. The question about mixing beforehand, no, do not mix this one beforehand. It becomes unstable that way. There have also been thoughts that there's a chance that this medication could be altered somehow if it is in the plastic vial or in the plastic syringe beforehand. So we just don't want you to mix it beforehand if you don't have to. And what was the third question, Morgan?
No, I think you answered it. It was if you could store it outside, but you kind of answered with the fridge being the best place for that. And then final question that I see come through so far is, what happens if, let's say, a patient's dose is supposed to be 2 powdered vials of the Minipure, but they only gave themselves one dose, so let's say they missed a dose, what should they do?
Okay, good question. So if you give yourself less than you're supposed to, and you realize it, then you'll just need to mix that extra dose that you missed. Just mix it when you remember and give yourself that second shot. If you give yourself too much, please just let the clinic know how much you gave, and they can give you instructions on what to do next, but it will not ruin your cycle. So you don't have to worry about that. I'm not hearing anything.
I tell patients that all the time, that you're going to make hopefully not make way more mistakes, but it's very, very common. And the worst thing they can do is stress out about it. Okay, I don't think I see any more questions. Any other feedback on Minipure before we get the next video rolling?
I think that I do have one little helpful hint. Some people will feel a little overwhelmed and think they might forget how to mix it, or they might, they're worried about making a mistake. So I have suggested to some people that they prepare little sandwich bags with each baggie with everything they're going to need for that one shot. So just put your Minipure vials, your saline, your syringe, your Q-cap, your little 1/2-inch needle, and your little alcohol prep pad, put it all in a baggie and seal it up. And you can do that for your whole cycle. So you have everything ready. Every baggie is one shot. And then you know it's there and you know what to get out, and you don't have to remember that. So just a little helpful hint.
Oh, that's actually a really great tip. I've been doing fertility for a long time and never even thought about that. Okay, we have actually 2 more questions that have come through. Someone asked, I've never been told to store Minipure in the fridge. Is this a problem?
Absolutely not. It can be stored at room temperature. 68 to 77 degrees is perfectly fine. If you have to mix it and give only a partial shot, and you have some that's mixed already that you have to put in that you can't give right away, then you do want to put that in the refrigerator. But if you can put it in the refrigerator, go ahead and do it, because that's the safest place for it.
Okay, perfect. That actually answered both questions were with that they said they've been storing their Minipure not in the fridge. So you answered that flawlessly. Okay, so I'll get us rolling on our next video.
Hi, my name is Laurel, and today I'm going to demonstrate how to use the Gonolife Pen. The Gonolife Pen is a really cool little pen here. It's super easy to use. All you have to do is dial your dose that the clinic has told you to take, and if you go too far, you can just dial it back. You can go back and forth. It's not going to hurt the pen. So just find your dose. A typical dose is 300 units, so that's what I'm going to demonstrate today. Not sure if you can see that very well, but there's 300 units. You take your needle, pull off the tab. There's a needle on this side, which goes in to access the medication. You twist it all the way on, and then you pull off the outer 2 caps. You find a spot in your tummy, anywhere in your tummy, as long as it's at least 1 inch away from the belly button. And you don't want to inject into a spot that already has a little bruise or any soreness or redness from a previous shot. You're going to find a spot in the belly that has some fatty tissue that you can squeeze. You're going to squeeze the belly, go straight in like a dart, let go of the squeeze, and inject the medication. It will click, 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 click until it's already all instilled. In the little window, you will see 0, and you'll know that you're done. So you wait 3 seconds, have a Kleenex handy, pull out, and hold your skin. If after about 10 to 15 seconds, your skin is dry, then you're done. If you do notice some medicine leaking out or some bleeding, which can happen, it's not Not something that is a problem, but you just need to hold your skin a little longer until it's dry. The pen now has a medication still left in it, so you don't want to throw that away. You want to take your large cap, slide it on there, twist it off. This part will go in the sharps container, and then the cap goes back on the pen, and you can put it back in the refrigerator for the following injection. And that's all there is to that. Okay, any questions about the Gonolife pen?
Yes. Okay. So someone says, I hope this is an okay question as I don't use the Gonolife pen, but I said she has the vial, the 450 vial. I received from 2 different pharmacies. One sent in a cooler with ice and the other sent it in a box. Why would they be sending it differently? Also, I saw them in the fridge. Is this okay?
Absolutely, yeah, good question. So the vial comes with a powder and a liquid. And when it's time to take your first dose, you're going to put the liquid into the powder and you're going to draw up your prescribed dose with the syringes that come in the box. That can be kept in the refrigerator or at room temperature. They're both fine. Let's see, the other question was, one was a cooler, and one was just a box. So because it's okay at room temperature, you don't have to worry that one did not come in a cooler. It's not a problem.
Perfect. And then someone else asked, in the diaphragm that you showed to do the injections, do the numbers and colors mean anything?
No, they mean that we just want you to rotate around in your belly. Do not inject into a bruise from a previous shot, but you don't have to specifically use like quadrant 1, 2, 3, 4. We just want you to get the idea that you want to rotate around on the abdomen.
Perfect. Okay, another question is, what is Gonolife actually doing? What is it mimicking in a female's normal cycle?
Oh, good question. Okay, so Gonolife is FSH, or follicle stimulating hormone. And in a normal menstrual cycle, your brain does produce this hormone and it tells the follicles to grow. And so in an IVF cycle, instead of having kind of a small amount of FSH normal, which would stimulate only one follicle to grow to maturity and ovulate, the IVF cycle, you get a very large dose of FSH on a daily basis. And this stimulates all of the antral follicles to grow in order to harvest as many eggs as possible for that cycle.
Perfect. Okay, another question that came in is, sorry, let me read this to make sure. Oh, how, I think you kind of touched base on this, but there's kind of a question of just making sure they're storing the pen appropriately. I think you kind of answered it, but maybe just touch base again one more time, just make sure everyone's clear on how you store your pen appropriately or your vial.
Right. So the pen should be kept in the refrigerator. If you do so, it's good until the expiration date on the box, which is several months, usually, 6 or more months. If you store it at room temperature, it's good for 3 months from the time that it starts at room temperature. So that's why it's better to keep it in the refrigerator, because then it's good until the expiration date on the box. Once you've used that pen one time, it's been punctured, so then it's only good for 28 days. So that's a good thing to know as well.
Perfect. Someone has a really good question. I love this question. Any ideas or tips on how to save money on these fertility medications, especially Gonolife, because it is pretty pricey?
Yes, indeed. Okay. So Gonolife, you can get a discount on Gonolife through the Compassionate Care program. It is income-based, so you're going to save more if you make less. However, they do give you a discount even just for applying, regardless of how much your income is. So I highly recommend applying for Compassionate Care, and Mandel's can tell you about that. And then there are other programs out there to save money on your medications, and Mandel's is really good at just sharing with you all of those different programs so that you can apply for what applies to your medication.
Thank you so much. I think that's so important to make sure we're trying to save our patients as much money as possible, because we definitely know how expensive this can be.
Mhm.
And then last question is, can you touch base? Someone has heard their friend or it mentioned about overfill in the pen. Can you just kind of discuss what that means when you have overfill in a Gonolife pen?
Absolutely, yeah. So a Gonolife pen, regardless of the amount in the pen, it could be a 300, a 450, or 900. They all have 100 units of overfill. It's perfectly good medication. It's just extra that you are given. The vial comes with an extra 150 units in each vial. So, buying the vials is another good way to save a little bit more money, because you do get a little bit of that extra added in there. But the pen, in my opinion, is just a little bit easier to use. I'm not sure it's worth the savings. But yes, definitely do not throw out that overfill. Use it. It is going to save you money in the long run.
Perfect. Okay, a couple more questions. Someone said, if I've had the Gonolife pen for at least 10 days outside, can I put it in the fridge now?
Ooh, that's a very good question.
Mhm.
So, yes, it's going to prolong the life of it. My guess is if you just got your Gonolife, it's going to be used up pretty quickly, and you don't have to worry about it lasting more than 3 months. So technically, since was out of the refrigerator for those 10 days, it is only going to be good for 3 months from the time it was taken out of the refrigerator.
Okay, another question we have, when I take it out of the refrigerator, how long should I wait to inject? Is it okay to inject when it's cold?
Yes, it's perfectly fine to inject it right away. Some people do like to take it out for about 10 minutes prior to injecting, because then it maybe doesn't hurt as much, but it's not technically necessary.
Okay, perfect. I think that's all the questions as of right now. If you have anything else you want to add about the Gonolife Jet pen, I'll get us loaded for the next video.
All right. I think I covered everything with Gonolife Pen. It's a great device, and I'm glad you had so many questions about it. I'm glad that I could help. And let's get started with the progesterone and oil video. Hi, everyone. My name is Laurel Meier, and today I'm going to share with you how to draw up and inject the progesterone and oil. This is a picture of an example. It is made by different manufacturers, so your vial might not look just like this one, but it does always come in 500 milligrams per 10 milliliters, which is the same as 50 milligrams per ml. It's a 10 ml vial, and the typical dose is 1 milliliter per day. So the vial has 10 doses or 10 days worth. The common bases are sesame oil and ethyl oleate, although it does come with some different bases. These are the most common. The progesterone and oil is used in a FET or frozen embryo transfer cycle to change the receptivity of the uterine lining and prepare it for the embryo transfer, and then maintain the uterine lining after the transfer to keep that uterine lining in a good, nice place for the embryo to grow. So next, we're going to go over the IM injection sites. There are 2 sites that we typically use. On the left here is the ventrogluteal muscle, and with this site, you do need to aspirate, and we'll talk about that in a few minutes. The ventrogluteal muscle is the ideal site. It is a larger muscle. There are no vessels or nerves that are large enough to puncture or to damage, and there's no aspiration needed. So this is really the ideal site for the IM injection. We are going to go over how to find these, and you can see by the picture that if your partner is finding the ventrogluteal site for you, they'll find the hip bone on the side of your body, put their fingers just below the hip bone, and spread the fingers apart. And that triangle is the area of injection. If you're trying to find the site yourself, I want you right now to find your hip bone on the side of your body, feel for your hip bone, and then slide your fingers down about 2 inches below the hip bone. This is the ventrogluteal muscle. Then if you slide your fingers back from the ventrogluteal muscle about 2 to 3 inches, this is the dorsogluteal muscle, straight back from there. So that's how you can find the site yourself. So now I'm going to show you how to draw up the progesterone and oil and give it yourself. So the first thing you're going to do is collect all your supplies. You need a 3 ml syringe with a needle attached. When you take it out of the paper, you'll just need to make sure it's twisted on all the way. The reason why these are not twisted on all the way is because with the sterilization, they have to have them a little bit loose. So twist it on, open up your other needle, which is for giving your progesterone. Open up your progesterone and oil, and then you have your alcohol wipe. Always alcohol the top of your progesterone before you get started. Make sure you've washed your hands and that you've dried them thoroughly. And then you're going to draw up the amount of air equivalent to your dose. And I'm milliliter as an example. So take off your cap, inject the needle into the circle in the top, turn everything upside down, and then you want to make sure that you can see the tip of the needle in the oil. Push the air in and pull back and let that oil drip down the side. It can take a little while, so just be patient with it. You can see that it's dripping down the side. And the thinner the needle, the longer it takes to draw it up. So if they give you a large bore needle, you can go ahead and use that because it'll make it a lot faster to draw it up. But whatever they give you that's already attached to the syringe is the one you're going to be drawing it up with. So keep going until you're a little past the 1 line. And you do have to be patient with this one. And then push out. And if you see little teeny bubbles, you can ignore them, but any large bubbles you're going to want to get rid of. And you push right to the 1 line so that the black line is on the 1 line. Turn it back up, right side up, take the needle out, and you want to recap with a one-handed technique. So you take the cap on the counter and you just scoop it up and click. Now you're going to switch over to the give needle. So you twist it off, twist on your other needle. Now you're ready to give the shot. Now to prepare to receive the shot, you need to have your muscle as relaxed as possible. So what you want to do, my suggestion is just to lay on a bed on your side, and your partner can sit on the bed next to you to give you your shot. Another option is if you'd like to stand, you can stand at a counter using the counter as like a balance point. You want to put all of your weight on the opposite leg from the side you're receiving your shot. You can keep your toe on the ground just for balance, and your partner can sit in a chair next to you and give your shot that way. Also, if you're giving your shot yourself, I would use the standing technique. You've got the counter for stability, and you can use your dominant hand to give it in the dominant side. Just to get started, you'll definitely want to do that. All right, so let's get started with the actual injection. Another thing I wanted to discuss is ways to make this shot less painful. It looks pretty intimidating. It's not as painful as you think it would be, but there are ways to make it completely painless. You can either get EMLA cream or a numbing cream or a numbing patch. That works really well. You can use ice on the site for 30 to 60 seconds. Just ice your skin. And another really nifty technique is a tickle technique. That's what I call it. And what that is tickling the skin next to the site while you're injecting. And what that does is it takes advantage of the gate theory, the gate nerve theory, by distracting your skin into not feeling the poke. So it's really nifty and it works pretty darn well. So Using one of those techniques, I'll use the Tickle Technique just to show you how it works. Take off your, oops, before I take that off, I'm going to alcohol my skin a little bit and let it dry. And then you're going to give your shot. The Tickle Technique is just a little bit of tickling, and then you go straight in like a dart. Now, if you're in the dorsal gluteal site, which is that upper outer quadrant of the buttocks in the back, you're going to want to aspirate. And what that is pulling back on the plunger and looking for blood return. You're not going to pull real hard, but you're going to pull a little bit and look to see if blood comes into the syringe. It's very rare, but if the blood does come into the syringe, it means that the tip of the needle, which would be way down here in the muscle, is lodged directly in a blood vessel. And we don't want to give the medication into a blood vessel. So what you would need to do at that point is pull out, change to a new needle, and give the shot in a different site. If you use the side of your hip or the ventrogluteal site, you can skip that step completely, okay? So you'd go in like a dart, you'd inject, and it's going to take a little bit of time, so just push fairly hard. It's a skinny needle, and you've got a thick oil base. Once it's already injected, wait about a minute, 30 seconds, and then pull straight out with pressure. This will go in the sharps container, and you're just going to hold for about a minute. Keep the weight off of your muscle, off your leg, and then check. The partner's going to check the site. If it's bleeding or there's medicine leaking out, they'll continue to hold it. And if it's dry, then you're done. No Band-Aid needed. And that's all there is to it.
Okay.
Right. Questions on progesterone?
Yes, it looks like we have a couple. So for first question is, patient said, for the progesterone oil, unfortunately, my transfer did not take. So I stopped taking it a week and a half ago. Since then, I've noticed 2 red splotchy, very itchy splotches at the injection site. I didn't have this type of reaction while taking it, so now I'm concerned. Is this normal? I don't have any known allergies to any medication.
Oh, good
sounds
question.
like she had, some reactions after she stopped it.
After you stopped. Okay. So medication allergies can happen over time. They can even happen after you've stopped. Most likely you are having a local reaction to the sesame oil, and stopping it is the best thing that you can do for that. I would say that you can apply Benadryl cream or hydrocortisone cream to the site, and that will reduce that inflammation and itchiness. If that doesn't help enough, you can take Benadryl tablets orally, but I would wait. I would take 25 to 50 milligrams of Benadryl at bedtime because it's going to make you really sleepy too. Now, another thing is if you were continuing on in your FET cycle, I'm so sorry it didn't work, but if you were continuing on in it, we would suggest that you switch over to a different base called ethyl oleate. So just for future reference, if you do another FET, please let your clinic know that you had this reaction and that you would like to use ethyl oleate instead.
That perfect segue to my next question was the different types of oil. So some patients are saying they're on different types. Does it matter what type you're on? And then why are we using oil instead of saline or water?
Oh, good question. Okay. So yeah, there are different types of oil, and your clinic is just going to order what they're most comfortable with, but there's really no reason why you can't switch out if you have an allergic reaction to one. So progesterone and sesame oil is the most common, is I think the least expensive. So that might be the key reason why your clinic would order that first. But if you do have an allergic reaction to it, you can get the ethyl oleate, and that is a little bit more expensive, but definitely worth it if you're having a reaction. Now, to the question of why is it IM versus sub-Q? So oil-based medications, and unfortunately the progesterone is in an oil base at this time in the US. Oil-based medications need to go into the muscle because it absorbs better, and you get a longer lasting, you get that progesterone to be at a consistent level for the 24 hours until you take your next shot. And also this causes a lot of irritation, discomfort, in the fatty tissue. So you really have to go all the way in, all the way to the hub, so that you make sure that you get that needle past the fatty tissue and into the muscle, so it doesn't cause a lot of pain. It's very painful if you get it in the fatty tissue.
Perfect. I think the biggest key is going all the way in. I know some patients are hesitant because they think it's going to hurt more if they don't, but actually it's doing more harm if not. So very good point on that. Someone else asked, is a lidocaine roll okay to use? My clinic has me using a 20 gauge needle and it hurts at the injection.
So I'm not sure what a lidocaine roll is. It's okay to use lidocaine. It comes in, as far as I know, it comes in a cream called an EMLA cream or a lidocaine cream, and you can use that. It typically takes about 30 to 60 minutes to work. So you'd want to spread that cream on your injection site, about a quarter size, a little circle of it right on the injection site. Cover it with saran wrap, tape it down with paper tape that you can get at any pharmacy, and then just set yourself an alarm for 60 minutes. And by the time it goes off, you can wipe it away with a washcloth, wet washcloth, alcohol prep on your skin, and you can give the shot in that site and you will not feel it.
It really is a miracle drug. Also, same kind of thing as like with the Sanera patches as well. So very, very similar. And another question that came through, can a progesterone suppository be used instead of the progesterone in oil?
Good question. So different clinics are going to feel differently about this one. The suppositories have been studied with good success rates. Progesterone in oil just has been studied more and is maybe slightly more effective at getting those blood levels and estrogen, progesterone levels, or not estrogen, but progesterone levels in the uterus up to where they need to be. So suppositories are a good option, but do check with your clinic to see if they're comfortable with that. Some clinics will want to wait until you are at the point where you're having your prenatal ultrasound and you can see the little heartbeat, and then they would be comfortable moving you from the injection to the suppositories. So you can ask them about that too.
Okay, and then how should a patient store the progesterone oil before using it, if they get their medications ahead of time, and then after using their first injection?
So progesterone oil is always stored at room temperature. You don't want to refrigerate it because it gets too thick and it's too hard to draw up and give. So always keep this at room temperature. Once you've opened it, same thing. It's a room temperature medication. Just make sure that you use an alcohol prep pad on the top of the vial prior to drawing it up.
Okay, and is it okay to ice the site, the injection site, before giving the injection, or icing afterwards, or do you recommend heat?
Oh, good question. So icing prior is my suggestion, and heat after. So if you take a long sock and you put rice in it and you tie a knot and you stick it in the microwave for a minute or two, you can use that rice ball to massage the site afterwards. And that's a moist heat that's really going to help that medication absorb into the muscle, absorb into the bloodstream fast, and really get it into the circulation. The best thing to do, in my opinion, is to give the shot in the morning, because when you're using the muscle all day, it's working into your system and it's not sitting in a ball in your muscle. The worst thing you can do is give this shot right before bed and then just go to sleep without using the muscle at all, or without giving it any massage with a warm compress.
Totally agree with doing it in the morning, especially I think that helps prevent getting those knots that sometimes patients will read about or hear about, the kind of those horror stories. And I also always recommend patients to take like a hot shower afterwards and really massage the area. Same thing with like the heat helping disperse the oil, and also just helps with the discomfort. Okay, it looks like another question that came through is is it better to have my spouse or partner give the progesterone oil medication, or better to give it myself? Do you have any recommendations on which way is better?
So I would recommend giving it however you feel most comfortable. So I think giving it yourself is pretty intimidating. It's a long needle. It's difficult to give yourself a shot because your brain is saying, no, don't hurt yourself. You know, it's a natural reaction. So my suggestion would be have your partner, friend, or family member give you the shot. But if you are one of those people that likes to be in control and likes to do it yourself, then by all means do it yourself.
Okay, I love how you said that. You should do it however you feel most comfortable with it. So that's great advice. Okay, I don't have any other questions. If anyone has any other questions over any of these medications, the Minipure, the Gonolife, or the progesterone oil, feel free to kind of ask. But otherwise, Laurel, if you have any other feedback or comments, and if not, we'll kind of close out.
Yeah, just one interesting thing that I found out about recently. There's a lot of patients that ask, why can't this medication be given subcutaneously? And there actually is a medication called Prolutex, and it is being used in Europe and actually 32 countries in total. And it is a subcutaneous progesterone. So I just want you, it's being worked on as far as, getting authorized, to use in the United States. So hopefully there's hope for the future that we will have a subcutaneous progesterone for you.
Oh, that's so neat. I didn't know that at all. So that's super encouraging, hopefully. Hopefully all of our patients listening today are way past giving their injections, but that is super exciting for the future. Okay, if you have any other closing feedback, and if not, we'll close this out.
All right, no, that's about it. I just want to encourage you all to take this one step at a time. You will build your family. You will get there. Keep the faith.
Perfect. Thanks again, Laurel, for your expertise and all of your answering the questions. I know there were quite a few of them, and you answered them all flawlessly. And thanks for sharing your story. I think it maybe helps a little bit so people know that you've kind of experienced what they're going through. So thanks again for everything for tonight. And everyone, just thanks again for joining us. Your questions were amazing. If you don't ask them, someone else a lot of times won't. So thank you for being active participants. We really appreciate that. And just want to remind everyone that we do these every Monday at 7 p.m. Eastern Standard Time. We do them via Zoom and Facebook Live. We do medications new each week. So if the medications you have questions about weren't on today's webinar, then definitely tune in next week, and hopefully we'll cover them as well. And just also know that all these videos are going to be available for you via on YouTube, on Facebook versus My Mandel's Pharmacy Facebook page, or also on the yeah, I think that's it. Just the YouTube, Facebook, sorry, and then on demand on the Mandel's website. So invite your friends, invite your family, anyone you know going to this. We love to see new faces on these Zoom and Facebook Live calls each week, and hope everyone has the best night and a great week. Looking forward to talking to you all next week. Take care.
Take care. Bye.